I'm going to talk about fibromyalgia, and I'm going to talk about it in a slightly different way than it's normally spoken of, because I'm not going to talk about the conventional, you make the diagnosis by pressing on 18 points, and if 11 of those 18 points are painful, person has fibromyalgia, and then you look up the treatments of fibromyalgia, which constitute mainly pharmaceutical agents like Lyrica and Cymbalta and other medications like that. That's not how I'm going to talk about fibromyalgia. I would like to speak of it using a functional medicine approach, which is taken from the Institute for Functional Medicine. So if you look at fibromyalgia that way, then I have found in my practice at least 5 subtypes of fibromyalgia: immunological fibromyalgia, hormonal fibromyalgia, iatrogenic or caused by medication fibromyalgia, nutritional deficiency fibromyalgia, or toxicity fibromyalgia. So I have examples of each one of those, and I'm going to start with immunological fibromyalgia. So what is that? Very often, people with symptoms of pain all over, which is what fibromyalgia is, go to rheumatologists, or their primary care physician refers them to a rheumatologist. And what does a rheumatologist generally do? They do an inflammatory workup. So they're looking for inflammatory markers like a SED rate or a C-reactive protein. But they also look for other markers like ANA, rheumatoid factor. What are they doing this for? They want a precise diagnosis. They want to see, does this person actually have rheumatoid arthritis or lupus or Sjogren's syndrome or ankylosing spondylitis or Reiter syndromes, many of these inflammatory autoimmune diseases. The problem comes in when some of the inflammatory markers are elevated, but they don't get the precise diagnosis of a rheumatological disorder like the ones I just mentioned. Then they say, usually, you have fibromyalgia, go to a pain specialist. That's when they end up with me. But that's not the end of the story. The story really begins when you try to figure out what kind of fibromyalgia does this person have. And like I already said, it can be one of 5 major types. So I'm going to talk about Alice, because Alice had immunological fibromyalgia. She went to her rheumatologist. Her rheumatologist did blood tests, saw elevated inflammatory markers, but nothing that suggested a particular arthritis or autoimmune disease. But still there's inflammatory markers, so something's going on. So the patient comes to me. Now, I was asked by a nearby hospital to give a talk years ago on celiac disease. And celiac disease is an autoimmune inflammatory disease. What is fascinating about celiac disease, as many of you know, is that it's triggered by one substance and one substance only, which is gluten, which is found typically in wheat, barley, and rye. If you assiduously avoid gluten, there's no manifestation of the disease. It becomes quiescent or asymptomatic. What was fascinating about the subject that I was studying to prepare for my talk on celiac disease is I came across an article that got to the root of what autoimmune diseases are. And the conclusion was that all autoimmune diseases have a trigger, not just celiac disease. The difference being that the triggers might be different. They may not be gluten. They may be dairy. They may be peanuts. They may be environmental allergens like grasses or trees or pollen or dust mites or even animal dander. And the same thing goes for a immunological fibromyalgia patient. So in the case of Alice, I did IgG, IgE, and IgA antibody testing. And what I found is that there were certain foods that Alice was sensitive to. And then she went that further mile, which doctors love when patients do that. She actually hired a dietitian to develop a diet that would avoid the allergens that we had identified. And lo and behold, she had very, very little symptoms of fibromyalgia after that. So that's the story of Alice and how there is that one subtype of fibromyalgia, which I call immunological fibromyalgia.